Any tendon reconstruction would have problems. Problem which is possible is rupture. The rupture happen mostly at the level of knot. The re-rupture incidence is more in the second week, that is 5 to in the first 5 to 21 days. The other thing which can happen is adhesions and which need tenodesis. A tenolysis should be done at least after 6 months. Another complication is triggering. Triggering happens because of the tendon healed with the bleb formation, which can get entrapped in the pulley system. Then there is a quadriga effect which can happen. Quadriga happens because of the FDPs of the middle and the little finger works as a single unit and share common muscle belly. So when one of the tendon is repaired under tension, the other finger's excursion is not optimal. So the grip is reduced and the patient is not able to flex completely the normal digits. That's why it is advised that not to repair the tendons if the shortening is more than 1 centimeter.